Dr. Huang, what is the current role of artificial intelligence or AI in gastric cancer care, and how do you envision the role of AI in the future management of gastric cancer?
Yeah, it's a great question. Very early days for AI, but AI is really the hot topic in the field of medicine, and AI will definitely play a role in the detection of gastric cancer on probably many fronts. Obviously the most straightforward one is during endoscopy, we can use AI to help identify early gastric cancer. And one of the issues in the United States is since gastric cancer is a relatively rare finding and it can be very subtle on endoscopy, a lot of endoscopists can miss an early gastric cancer or a precancerous lesion. And so we're hoping to use AI to better identify these lesions since they're not super common and we're really not taught to look for these lesions. This is an area that AI can be helpful. But the other, probably easier implementations of AI would be through just medical records and just using AI to help identify people who are at high risk and then flagging these patients for physicians to say, hey, this patient should be considered for H. pylori testing. This patient should be considered for endoscopic screening. So I think that's actually a simpler implementation of AI. So I think AI will definitely help. It should help with outcomes. The challenge really is kind of working with the FDA to allow AI to be implemented in the clinical setting. That's not a really simple task because there's AI can also potentially be used for nefarious reasons, and so we certainly have to protect patients' identities. We have to protect patients' information, and so there's a lot of steps and a lot of responsibility that comes with AI. But I would say stay tuned. It will definitely, you'll see more and more AI implementation over the years to come. And overall, it should be very positive for patients for all disease processes, including gastric cancer.